Hello, everyone. My name is Kaylee Hines, and I have been working with Jasmine, Ian, and MJ on this project. Our team decided to focus on maternal and child health in Uganda, as it is a very common global health care issue that is still a concern today. So, as an overview of what will be discussed in this presentation, is that maternal and child health continues to be a critical global health care issue, with disparities in access, quality, and outcomes affecting millions around the world. Our project examines this challenge through the lens of health information technology, analyzing current IT solutions aimed at improving maternal and child health outcomes. Our team will critically assess the impacts and implications of these technologies, propose an innovative solution to enhance healthcare quality and safety, and compare our proposed solution with a real-world case study where a similar IT solution was implemented. Furthermore, we will offer a global perspective on how different regions tackle this issue, highlighting both challenges and successes in improving maternal and child health through technology and also other initiatives. So the first challenge that plays a part in maternal and child health in Uganda is high maternal and child mortality rates. So the 2022 Uganda Demographic and Health Survey reports that Uganda's maternal mortality ratio remains high at 189 deaths per 100,000 live births. The under 5 mortality rate is 64 deaths per 1,000 live births, and the neonatal mortality rate is 22 deaths per 1,000 births. While there have been improvements, these figures indicate that maternal and child mortality is still a significant public health concern in Uganda. While Uganda has seen significant reductions in maternal and child mortality over the years, the rates remain above global targets, indicating persistent challenges in healthcare access, quality of care, and resource availability. Rural community health centers plays also a key role in primary care for mothers and children. The patient's first point of contact at a healthcare center is a community care worker, or also known as a village health team, who is responsible for rendering primary care to the patients, specifically mothers and children. However, in recent years, it has been identified there has been a shortage of village health team resources. The critical shortage of these teams is partly contributing to many women dying from pregnancy and childbirth-related causes, at 336 overall deaths per 100,000 live births. These high maternal mortality rates could be lowered if community health centers could maintain a steady employee retention rate. The United States Agency for International Development has funded maternal and child health initiatives across 25 priority countries in Africa and Southern Asia. These efforts have focused on essential newborn care, postnatal visits, skilled birth attendance, and emergency obstetric care. From 2012 to 2020, these interventions have contributed to saving approximately 15 million children and 600,000 women's lives, demonstrating the impact of targeted global health investments in reducing maternal and child mortality. Another challenge that contributes to maternal and child health in Uganda is limited access to healthcare services. Access to equitable maternal health care is crucial for ensuring the well-being of women and newborns before, during, and after childbirth. However, various barriers hinder access to adequate care, including the distance between patients and healthcare facilities. In sub-Saharan Africa, including Uganda, over 170 million people live more than 2 hours away from a hospital, and 40% reside more than 4 hours from community health centers. These geographical posed challenges negatively impacts maternal and child health outcomes, highlighting the need for improved healthcare accessibility and infrastructure. A significant challenge in Uganda is a lack of adequate antenatal care. Reports indicate that 6% of Ugandan women receive no antenatal care, while 68% receive fewer than the 4 visits recommended by the World Health Organization. This issue is most severe in rural areas where transportation costs and reliability pose major barriers to accessing care. Addressing these challenges is crucial for improving maternal and child health outcomes across the country. In 2012, the MSD for Ugandan Mothers program was launched to expand access to affordable and equitable maternal health services. One of the major barriers to care for pregnant women in Uganda is transportation. So to address this, the program partnered with another program called TransEd to offer affordable transportation options for women, ensuring they can travel to healthcare facilities during labor and emergencies. This initiative has been vital in helping women access the care they need, especially in rural areas where transportation is often unreliable or too expensive. Another factor that contributes to this global health issue is malnutrition and infectious diseases. So according to the World Health Organization, over 268,000 children in Uganda suffer from malnutrition. Malnutrition among mothers and children heightens healthcare costs and limits educational opportunities, which increases the likelihood of poverty, which also fuels malnutrition. There are various organizations and initiatives in place to address this challenge. The European Union funded a 4-year NIS program starting in 2020 that focused on identifying early trends or detection of malnutrition through data collection tools and interpretation of data. In one of the articles posed by the NIS program, it states that one mother credited this project for saving her own child's life. She stated that a community health care worker visited her home where they measured her son's arm and immediately detected severe acute malnutrition. The child was then sent to a healthcare facility for treatment. Another factor is infectious diseases such as pneumonia, diarrhea, and malaria being the leading causes of maternal and child mortality. Malnutrition contributes to around 45% of children's deaths, making children more susceptible to severe illnesses. Addressing these health threats is crucial for improving survival rates and reducing mortality. One initiative that has been in place is the Integrative Community Case Management, which is an equity-driven approach designed to improve healthcare access for children under 5 in rural areas. In this initiative, there are trained community members who diagnose and treat common conditions like malaria, pneumonia, and diarrhea, and refer severely ill children for further care. Many low-income countries, including Uganda, have adopted what is also the abbreviation ICCM policies, which are implemented through community healthcare workers in the public sector to reach underserved populations and reduce child mortality.
One of the biggest challenges for developing countries in healthcare is access to effective technology. Fortunately, there are numerous open source, free or low-cost EHRs, electronic health record systems. In fact, the most popular EHR in the world, which is OpenEMR, is free and open source. Most of these open source, meaning that the code itself is visible and accessible to modify, start with the basic functionalities needed, or sometimes even more, and have modules that can be plugged in for free or sometimes bought for extended functionality. Installation and configuration, however, will require a good deal of technical knowledge, so the ministry, hospital, or clinic will need to pay someone to get it up and running. But there's no subscription fee and no upfront cost, which is worlds more accessible than the millions of dollars that Epic and Cerner charge. Even Google has also joined parts of the free EHR ecosystem with Google Health, and specifically Care Studio, which provides a great deal of functionality needed in EHRs for free. Now armed with appropriate tools like electronic health records, the EHRs, and the databases that come with them, clinicians are able to work more effectively, order tests and prescriptions they need electronically rather than on paper, and see the ongoing results in both the patient's chart and in the overall trends of their patient base. In 2025, there are a number of free or inexpensive EHRs that are available to countries on a low budget like Uganda. Having these tools increases the efficiency and effectiveness of the clinicians as well as patient compliance over time. Electronic prescriptions, of course, depend on the pharmacies being able to receive these orders, which may or may not be possible in all cases. But the potential is there, and the pharmacies and country can grow into it with time. Regardless, even having the ability to track pharmaceutical orders and hopefully patient compliance can give clinicians and public health officials tremendous amounts of data to work with to improve health across the country. Many of these free or low-cost EHRs, electronic health records, have both individual and group statistical visualizations available. Being able to visualize data that would otherwise have been written in a paper chart not so long ago, especially in developing countries, gives clinicians and public health officials tools to see what is going on in the country and cities and states, allowing them to plan for broad and individual changing trends in a much shorter amount of time. On the individual level, the clinician can see how the patient is improving or declining over time in a way that's easier to digest than spreadsheets and boxes of data, while on the macro scale for public health officials, they're able to see what is coming and be able to react more effectively to it or even get ahead of it. Being able to collect large amounts of data from single or networks of clinics allows for countries that have never before had the ability to delve into the data and find significant patterns for the overall health of the country or individuals with certain patterns of symptoms or family history.
When evaluating the impact of IT solutions on maternal and child health, an identified success is the increased access of healthcare services. The shortage of healthcare professionals in rural regions has rendered telemedicine a transformative solution for mental health and pediatric care. Mobile-based consultations enable patients to communicate with physicians or mental health experts, thereby overcoming the obstacles posed by considerable travel distances to healthcare facilities. In developing countries such as Uganda, the adoption of mobile phones is markedly increasing. This surge in mobile phone usage has coincided with the development of related technologies and innovations exemplified by organizations like SafeBoda, which is in the forefront of utilizing digital technology in both transportation and delivery services. In Uganda, SafeBoda facilitates connections between individuals and mental health practitioners, as well as providing urgent counseling services via mobile platforms. Another successful impact of IT solutions on maternal and child health is improved availability of maternal and child health data. Electronic health record systems in Uganda have significantly enhanced the documentation of patient data, facilitating the ability of healthcare providers to monitor patients' progress, particularly within the realm of mental health and pediatric care. These systems contribute to improved continuity of care, particularly in scenarios where patients require visits to multiple facilities or consultation with various providers. The utilization of IT solutions for the collection and analysis of health data empowers both governmental bodies and non-governmental organizations to more effectively monitor public health trends and implement targeted interventions. Enhanced data systems facilitate improved tracking of child vaccination rates, nutritional status, and the prevalence of diseases such as malaria, all of which have a direct impact on child health. The identified challenges of IT solutions on maternal and child health is lack of technology integration. The current state of infrastructure remains insufficient to facilitate the extensive implementation of information technology solutions within the healthcare industry. Numerous healthcare facilities, particularly those located in rural regions, lack the essential technological resources such as computers, smartphones, and dependable internet access required to fully leverage digital health initiatives. Numerous information technology solutions in Uganda in the realms of mental and child health tend to function independently. This fragmentation is characterized by insufficient integration among various digital health platforms, which obstructs the smooth transition of information. For instance, a mobile application designed to monitor child health may not be connected to a national health system overseeing vaccination records, thereby constraining the efficiency of health interventions. Healthcare technologies often exhibit a greater level of complexity compared to tools designed to meet the needs of individual users. Additionally, the unique dynamics of the healthcare sector, characterized by stringent regulations, persistent budget deficits, and the interdependence among healthcare organizations, demand significant expansions in infrastructures and approach. Mobile health technologies have surfaced as a promising innovation in healthcare, potentially offering cost reductions, improved access to medical services, and enhanced clinical outcomes. Nevertheless, it is crucial to prioritize the acceptance and adoption of these tools to fully realize their benefits. Another challenge for these IT solutions on maternal and child health will be the lack of digital literacy. The existing conditions of infrastructure is inadequate to support the comprehensive deployment of information technology solutions in the healthcare industry. Many healthcare organizations located in Uganda are deficient in the critical technological resources, including computers, smartphones, and reliable internet connectivity, required to maximize the benefits of digital health initiatives. A substantial segment of the population in Uganda exhibits a deficiency in digital literacy. Many individuals, such as caregivers and patients, often lack familiarity with utilizing mobile phones or information technology platforms to access healthcare services. This inadequacy hinders the efficacy of mobile applications, e learning platforms, and various other digital health interventions. Not all healthcare professionals possess the necessary digital literacy or training to effectively utilize electronic health systems or telemedicine platforms. This disparity in skills can result in inadequate utilization of existing IT solutions, thereby constraining their potential influence on health outcomes. The implementation of mHealth tools will have a positive impact on maternal and child health in Uganda by being a resource for health education. The utilization of mHealth tools by primary health care providers in delivering maternal and child health services is influenced by their knowledge and attitude towards mHealth. It is imperative to implement interventions aimed to enhance the understanding and perception of mobile technologies, particularly internet based services such as smartphones, to foster improved knowledge, attitude, and application of M tools in maternal and child health services. A range of mobile health technologies are being employed as instrumental resources in the enhancement of maternal and child health. These technologies facilitate antenatal, delivery, and postnatal care services within communities. Countries with low to middle income levels, such as Uganda, stand to gain significantly from the implementation of mHealth strategies for purposes including data collection, appointment reminders, health promotion, and communication among healthcare providers. The proposed IT innovation is designed to incorporate a range of digital health tools that will enhance mental and child health services, facilitating real time access to healthcare information, support services, and reminders. This mHealth initiative seeks to overcome the challenges related to accessibility education, and continuity of care in the realm of maternal and child health, emergency alerts, and access to health facilities. An effective health system is characterized by its ability to respond adeptly to emergencies. The most successful healthcare systems worldwide prioritize timely access to healthcare and the equitable distribution of such access. In Uganda, a significant number of lives are lost as a result of the inadequate infrastructure for healthcare access, specifically in rural regions. Uganda has adopted digital health technologies, such as mobile applications, to enhance the management of emergency alerts. This initiative facilitates expedited reporting of suspected cases and improves communication between healthcare facilities and the communities they serve. Community health workers play an essential role in the healthcare system, utilizing mobile technology to detect potential cases, deliver basic medical care, and link individuals to required healthcare services within their community.
Case study comparison. Lessons from real world implementations. Amtrak, meaning Mobile Tracking of Health Services, is an initiative launched by the Ugandan Ministry of Health in collaboration with UNICEF. It integrates mobile technology to improve health service delivery by collecting real-time data on disease outbreaks, drug stock levels, and maternal health trends. Healthcare workers report cases via SMS, which helps authorities identify and address health challenges efficiently. Case study comparison. Key takeaways for implementation. Prioritize accessibility, meaning using mobile-based solutions like SMS or USSD can increase adoption, especially in rural areas with low smartphone penetration. Number two, ensure government and stockholder buy-in. Collaboration with the Ministry of Health, NGOs, and telecom providers can drive large-scale implementation. Number three, leverage real-time data. Continuous monitoring and rapid reporting mechanisms improve maternal health service delivery. Number four, invest in training and awareness. Healthcare providers and mothers need training to maximize the benefits of the IT solution. Number five, adopt a phased rollout approach. Piloting the solution in select districts before nationwide expansion can help refine the system based on feedback. Dashboard analytics for decision making. Government agencies receive real-time reports, allowing quick responses to health system challenges. Number two, community engagement. Citizens can send anonymous reports about healthcare services via toll-free SMS. Impact: improved drug supply chain efficiency, faster outbreak response, and strengthened healthcare surveillance. Global adaptive IT solutions, expanding impact across regions. This is for cultural adaptation, adapting to local beliefs about maternal health. In some regions, traditional birth attendants play a key role in maternal care. The solution should incorporate training and mobile reporting features for TBAs, ensuring they can digitally refer high-risk cases to formal health facilities. In areas where home births are common, the the app can provide culturally sensitive health education in local languages via audio or video message. Number two, multilingual and user-friendly interface. The system should report local languages and dialects to improve accessibility for low literacy populations. Voice-based features or chatbot assistants can be added to assist mothers who cannot read or write. In expanding impact across regions, economic adaptation. Economic disparities impact access to smartphones, internet connectivity, and healthcare low infrastructure. A. Low-cost technology for low-income regions. In low-income regions, the solution should prioritize SMS, USSD-based services, allowing users to access maternal health information and alerts without requiring smartphones or internet access. Government and NGOs can subsidize or partner with telecom providers to offer free SMS-based maternal health reporting. Number two, leveraging community healthcare workers. In countries with limited healthcare facilities, CHWs play a vital role. The system should provide offline functionalities where CHSWs collect data on mobile devices and sync when internet access is available. 3. Flexible funding and business models. The IT solution can be sustained through government funding, donor agencies, or public-private partnerships. Regulatory adaptation. A. Compliance with data privacy laws. Countries have different health data protection laws such as GDPR, HIPAA, or Uganda's Data Protection and Privacy Act. The system should incorporate role-based access controls, encryption, and anonymized data storage to meet legal requirements. Integration with existing health systems. B. Some regions may already have national health databases. The IT solution should be interoperable with existing EHR systems to ensure smooth data exchange. APIs, meaning application programming interfaces, can be used to integrate with government and health monitoring platforms.
Maternal and child health in Uganda faces persistent challenges, including high mortality rates, inadequate healthcare infrastructure, and a shortage of healthcare professionals, particularly in rural areas. While progress has been made through global health initiatives and increased investments, significant disparities remain in healthcare access and quality. Digital health technologies have emerged as transformative solutions, providing new avenues to improve maternal and child health outcomes. The adoption of mobile health solutions such as telemedicine, SMS based health alerts, and electronic health records has enhanced healthcare efficiency by streamlining patient data management, improving disease surveillance, and expanding access to care. Programs like MTRAC demonstrate the power of real time data collection in strengthening Uganda's health system, allowing for faster response time and better coordination among healthcare providers. However, infrastructure limitations, digital literacy gaps, and economic disparities hinder widespread implementation. Ensuring these technologies are low cost, accessible via basic mobile devices, and supported by community health workers is essential to bridging the healthcare gap. Despite these advances, fully integrating digital health solutions into Uganda's healthcare system remains challenging. Fragmentation among digital platforms, a lack of interoperability with national health databases, and limited funding threaten the sustainability of these initiatives. Strategic government collaboration with NGOs, private sector stakeholders, and international donors will be key to overcoming these obstacles. Additionally, investing in healthcare workforce training and public awareness programs will help maximize the impact of these digital interventions. So, addressing maternal and child health disparities in Uganda requires multifaceted approach, multifaceted approach, such as leveraging technology, strengthening healthcare infrastructure, and ensuring equitable access to care. While digital health solutions has immense potential, they must be a part of a broader sustainable strategy that prioritizes the well-being of mothers and children. By integrating innovative healthcare models with community-driven initiatives, Uganda can continue making strides towards reducing maternal and child mortality and achieving long-term health equity.